Welcome back. Some NHS dental patients are being asked to pay for private appointments if they want treatment. That, according to a health watchdog. Health Watch England says it spoke to one patient who was offered a procedure for £1,700. That would normally cost just 60 quid on the health service. Let's speak now to Imelda Redmond, General Director of Health Watch England. Imelda, great to have you on the programme this morning. Just how significant a backlog, just how difficult, in fact, is it to get in to see an NHS dentist at the moment?
Yes, well, it depends on which part of the country you're in, but in many parts of the country, it's very, very difficult to get an NHS dentist in a reasonable time frame. And we heard from people right across the country, and in parts, particularly of the northwest, it was particularly bad. Although we did hear from people right across the country during the pandemic to say that they were having difficulty accessing dental treatment at a reasonable time and at a reasonable price.
Some of the advice, though, that patients have been receiving is pretty hideous. One patient being told they needed to wait, 2 years for an appointment. Another told to use a nail file to deal with a broken tooth. Others advised to buy dental repair kits and do the job themselves.
That's right. I mean, people have been really let down. The quality of information is really poor, so that some people are ringing 50, 60 dentists before they can actually get an appointment. And then because of the pressure that dentists are under, they're resorting to asking people to do self-managed jobs, really. And just the scale of the distress that people have been through is extraordinary.
It is the case, though, as well, Imelda, isn't it, that to make dentist surgeries COVID secure has been a great struggle. There has been conflicting information being provided by central government to dentists themselves. I mean, we shouldn't be necessarily blaming them for the situation that's going on right now.
No, I think you're right. It is a really difficult situation for dentists. They can see only a proportion of the patients that they would have seen pre-pandemic, but we still need to make sure that the people who need the treatment are getting treatment. Dental care is a critical part of our overall care services. People are having terrible abscesses and having 3 courses of antibiotics. There are people who will have mouth cancer and won't have it diagnosed during this time. So I do understand it from the dentist's perspective. However, when people need treatment, they should be able to access it.
And Imelda, what then would your advice be to someone who is in desperate need of a dental procedure, who is being told, look, if you've got the money, you can pay for it, and they don't have the money?
Well, I think what you've got to do is make sure, you have to find a dentist who is doing NHS care and prioritising that. Now, that's not easy in some parts of the country, but just keep on trying. And then I would say trying to really negotiate that with that dentist, because it's unfair that you should have to go private because of the difficulties that dentists are facing. Please do get in touch with your Health Watch. There is one in every part of the country, so they'll be able to help you with very local information about where dentists practice are able to take on patients with high levels of need.
Otherwise, we are simply storing ourselves up problems for the future. I mean, you mentioned mouth cancer there.
Well, we are. I mean, as I said before, dental care is a critical part of our overall health care. It's really crucial for people. So we need to make sure that the Department of Health, that the government starts thinking about how do we rebuild dentistry so that our population has timely access to high quality and affordable dentistry. We're a year into the pandemic now, so it's really important that this is given quite urgent attention.
Imelda Redmond from Health Watch England. Great to have you on the programme this morning. Thanks for being with us.
Thank you.
Time for us to have a look at the weather. Here's Isabel.